Now I'm going to talk to you about the pancreas. Before I start talking to you about the pancreas, I'd like to say this. Jean-Pierre said it took him more than 20 years to really understand well the pancreas and the spleen. These are organs that are still at present. In a way, they work in mysterious ways, so not everything is understood about these two organs. So I'm going to tell you some things that we already know about them. So also, let's take a look. So pancreas, looking at its location in the abdominal cavity, pancreas is right behind the stomach. You can see it's the orange organ. Between the stomach and the pancreas, we have the omental bursa, that space I talked to you about, and the pancreas is connected intimately with the spleen. They are actually attached by, let's say, by tissues and by the vessels. And behind the pancreas, we have the left kidney. So let's take a look in more detail. So when we look at the topography of the pancreas, and we can see it here, so the pancreas starts slightly to the right of midline. This central part of the pancreas is the head of pancreas, and it is contained or surrounded by the duodenum. Then we have the body of the pancreas, and finally we have the tail. And the tail of the pancreas is crossing in front of the left kidney and going to be connected with the spleen. I have other pictures for that. Topographically, the pancreas is between L1, L2, the head sometimes a little bit of L3, but when you look at L2, the pancreas is crossing over L2. So in visceral manipulation, we say that when an organ is crossing in front of a vertebral segment, it has the ability to restrict it. So L2 is often in trouble, let's say, or in tension because of the pancreas. There are some associated skeletal restrictions with the pancreas. Back pain at the level between T9 and T11 primarily on the left side. Left sacroiliac joint, again, you will find left sacroiliac joint in some of the organs I'm talking today because they are going also to the left side of the body, and because the innervation of the sacroiliac joint comes from the lumbar plexus, and that is also innervating other organs. But L2 is one of the vertebra that often suffers with pancreas. One of the associated skeletal restrictions we may find, even if people don't come in and complain, is that we notice when our patients come into the clinic and they just sit, you can notice when people slightly forward leaning position sitting, where they kind of slump forward. This is the position to hug the lesion and to protect the pancreas, but that is something very common with people with restriction in their pancreas. So again, let's take a look at the stomach again by this time by Sobota. So we see the lesser omentum, we see the greater omentum is slightly open here, so we can see the transverse colon, and we can see the spleen right there on the side. We will go to the spleen right after pancreas. Now, again, lifting the stomach. So if when you were mobilizing your stomach, you were feeling organs posterior to that, maybe your hands were too deep. But lifting the stomach, what do we see? We can see the transverse colon. We can see the attachment of the greater omentum on the transverse colon. We can see the transverse mesocolon and the pancreas, right? Posterior to that. So in this picture from TIMS, we can see the way the pancreas is and the organs it associated with. So the pancreas is directly in connection with the duodenum, with the spleen, with the stomach missing in this picture, and the left kidney that you can see from this behind the posterior peritoneum. The pancreas is also connected with the gallbladder because of the connection of the common bile duct that is actually perforating posteriorly going through pancreas. I removed the kidney and the liver, and I removed the the gallbladder from this picture, and we can see the right kidney, we can see the left kidney, and we can see this is the head of the pancreas, and we can see the orientation of the pancreas. So the pancreas has a kind of a 30-degree orientation, very characteristic. So this is a way to identify the pancreas in the body.